Assalamualaikum and good morning everyone. I am Nuraina Atira binti Zainuddin, your host for today. With me, I have Mr. Ashraf, Miss Javia Shalini, and Miss Harush Ashwada. They are my special guests for today. The three of them, including myself, will be discussing on medical topic of male and female infertility. First of all, I would like to give an introduction about infertility. What is infertility? According to Center for Disease Control and Prevention, infertility is defined as not being able to get pregnant after 1 year or maybe longer than that of unprotected sexual intercourse. Now, let us start with the first speaker. Mr. Ashraf, I would like to ask you to explain furthermore on male infertility. Welcome, Mr. Ashraf.
Thank you. I'm Ashraf Abdulghani and I'll be discussing on erectile dysfunction. So erectile dysfunction is the inability to acquire or maintain or sustain an erection. Ironically enough, the causes of this condition can be easily remembered with the acronym PENIS. Now, the first one is psychotic, where the anticipation of sex can cause anxiety. This increases sympathetic nervous system activity, which leads to decreased parasympathetic nervous system activity. This will decrease in acetylcholine release due to the decrease in the parasympathetic nervous system. Right? So a decrease in the acetylcholine release, which leads to decrease in nitric oxide, which leads to decreased arterial flow. This is followed by a decrease in cavernosal expansion and results in no erection. Now, the second is endocrine causes, okay, such as hypogonadism, which Diana will explain further. Right. So the third one is neurogenic causes due to stroke, spinal cord injury, or diabetes mellitus neuropathy, which impairs the parasympathetic nervous system activity, which reduces acetylcholine, as discussed earlier, will not promote any erection. Right. So back down the downflow for acetylcholine. Right, based on the flow chart. So the fourth one is insufficient blood flow due to peripheral artery disease. So as you can imagine, how the penis erects is basically increased blood flow. So if there's any obstruction or reduction in blood supply to the peripheral artery, it will reduce the blood into the penis itself. So there's no erection initiated or maintained. Okay. And lastly is substance use, such as antipsychotics and selective serotonin reuptake inhibitors or SSRIs, which reduce the parasympathetic nervous system. As mentioned before, if you reduce the parasympathetic nervous system, this is choline, and then down the flow chart there will be no erection initiated. So that's for me for erectile dysfunction and its causes. Moving on to the next video. Thank you.
Thank you for your sharing just now, Mr. Ashraf. I would like to add on another type of male infertility that maybe not everyone ever heard before. This disease is due to reduce in hormone production known as hypogonadism. Hormones that involve are gonadotropin-releasing hormone, follicle stimulating hormone, and luteinizing hormone. In male, hypogonadism is divided into two basic types. The first one is primary, and the second one is secondary. Primary hypogonadism, or also known as primary testicular failure, is originates from a problem in the testicle itself. Meanwhile, secondary hypogonadism indicates a problem that happened in a hypothalamus or the pituitary gland. Either types of hypogonadism can be used by an inherited trait or something that happened later in life, such as an injury or an infection. At times, primary and secondary hypogonadism can be occurred together. Primary hypogonadism can be caused by Klinefelter syndrome, undescended testicle, mouth-orchitis, hemochromatosis, or injury to the testicle. Meanwhile, in secondary hypogonadism, it can be caused by Kallmann syndrome, pituitary disorder, inflammatory disease, HIV, medication, or obesity. That's all male infertility. There are more types of male infertility that my audience can check out from any medical website that can be trusted. I would like to move on to females' infertility diseases. Here I welcome our second speaker, Miss Javia.
Thank you, Diana. So now I would like to talk about the female infertility, which is polycystic ovary syndrome (PCOS). Polycystic ovary syndrome (PCOS) is a common hormonal condition that affects women during their adolescent age, which is the reproductive age. PCOS can cause hormonal imbalances, irregular periods, excess androgen level, and cysts in the ovaries. Irregular periods, usually with a lack of ovulation, can make it difficult to become pregnant. PCOS is a leading cause of infertility currently. PCOS is a chronic condition and cannot be cured. However, it can be improved throughout lifestyle changes, medications, as well as fertility treatments. So the causes would be due to obesity, excess of androgen, insulin resistance, heredity, as well as low-grade inflammation.
Thank you, Ms. Javia, for your explanation. Ms. Shahada, can you give another example on female infertility to the audience and all of us here in the studio?
Thank you, Diana. Now I will explain another female infertility disease, which is endometriosis. Endometriosis is a chronic condition where tissue similar to the lining of the uterus grows outside of the uterus, commonly on the ovaries, fallopian tubes, and other pelvic organs. This tissue responds to hormonal changes, breaking down and bleeding with each menstrual cycle. Unlike the uterine lining, this blood has no way to exit the body, leading to inflammation, pain, and the formation of scar tissue. Now, let's delve deeper into the causes of this widespread endometriosis disease. One of the causes of endometriosis is retrograde menstruation, where menstrual blood containing endometrial cells flows backward through the fallopian tubes into the pelvic cavity, implanting and growing on pelvic organs. However, retrograde menstruation alone cannot fully explain the occurrence of endometriosis in women who have undergone hysterectomies or who experience minimal menstrual flow. Other theories suggest genetic predisposition, where certain genetic mutation may make some women more susceptible to developing endometriosis. Other causes of endometriosis is immune system dysfunction. It is also implicated, as the body's immune response may fail to recognize and eliminate misplaced endometrial tissue, allowing it to proliferate and cause inflammation. Additionally, hormonal imbalance, environmental factors, and even epigenetic modifications are being investigated for their potential contribution to development of endometriosis.
That was a nice sharing given by Ms. Shahada. In our next section, it's about assisted reproductive technology. Before that, allow me to briefly explain what is assisted reproductive technology. According to Center for Disease Control and Prevention, ART includes all fertility treatments in which either eggs or embryos are handled. In general, assisted reproductive technology is a procedure that involves surgical removing eggs from a woman's ovary, combining them with sperm in the laboratory, and return them back to the woman's body. They do not include treatments in which only sperm are handled or procedure in which a woman takes medicine only to stimulate egg production without the intention of having eggs retrieved. The procedure of assisted reproductive technology that we usually use is IVF, or the full name is in vitro fertilization. So the procedure will be start with taking a birth control or estrogen to stop the development of ovarian cysts and control the timing of menstrual cycle. This allows to control the treatment and maximize the number of mature eggs during the egg retrieval procedure. In ovarian stimulation process, a hormone medication will be taken by injection to encourage the entire group of that cycle's egg to mature. Then, the response of the medication will be monitored by ultrasound and blood hormones level. Monitoring can be occurred daily or every few days over 2 weeks. Once the eggs are ready for final maturation, a trigger shot is given to finalize the maturation of your eggs in preparation for egg retrieval exactly 36 hours before the schedule. Healthcare provider will use an ultrasound to guide a thin needle into each of your ovaries through the vagina. The needle is connected to a suction device used to pull egg out of each follicle. The eggs are placed in a dish containing a special solution and then will be put in an incubator. After the egg retrieval procedure, the embryologist will try to fertilize all mature eggs using intracytoplasmic sperm injection. And over the next 5 to 6 days, development of embryo will be carefully monitored. Embryo must overcome significant hurdles to become an embryo suitable to transfer to the uterus. There are two types of embryo transfer. There is fresh embryo transfer and frozen embryo transfer. A fresh embryo transfer means embryo is inserted into the uterus between 3 and 7 days after the egg retrieval procedure. Meanwhile, a frozen embryo transfer means that frozen are thawed and inserted into the uterus. Lastly, pregnancy will be occur when the embryo implants itself into the lining of the uterus. The healthcare provider will use a blood test to determine if the person are pregnant approximately 9 to 14 days after the embryo transfer. Now, let's move on to the treatment. In the beginning, our speaker and me only be given the information on the types of infertility and the causes, but our audience might want to know what is the treatment for the diseases that has been mentioned before. Let's start again with Mr. Ashraf.
Thank you. So I'll be continuing for the treatment for my specific one, which is erectile dysfunction. Treatment focuses on increasing the blood flow. That's the main thing to initiate the erection, which is increasing the blood flow. If the problem is hormone related, treating the underlying causes should be done, such as testosterone hormone therapy. Okay, and if there's anxiety, there's simple medications for that as well. Increasing blood flow to the penis is by increasing the penile smooth muscle. In the flow chart here, you'll see that we need to increase the penile blood flow. So, acting on the smooth muscles, just to relax it, to let in blood into the penis itself. So the first line is by PDE5 inhibitors, such as sildenafil, if I'm not mistaken, and tadalafil. Which are inhibitors of PDE5 enzymes. Okay, if you inhibit the enzymes, this reduces the breakdown of cyclic GMP to GMP. Okay, so there's more cyclic GMP, which also promotes the progression into the flow chart to increase calcium reuptake to initiate the movement of blood into the penis itself. If that doesn't work, the second line is by the injection of alprostadil, which is a PGE1 agonist, which binds onto the PGE1 receptor to increase cyclic AMP itself, which will flow down the chart to achieve the erection, as mentioned before. So these are just two of the many ways to treat erectile dysfunction that I've mentioned. Thank you, and moving on to the next speaker. Thank you.
Thank you, Mr. Ashraf. And now I would like to tell the treatment for my disease, which is the hypergonadism. The treatment for hypergonadism is mainly on the testosterone replacement therapy by intravenous injection. If it's due to secondary hypergonadism such as pituitary problem, pituitary hormone is needed to stimulate sperm production. Or if it's due to pituitary tumor, a surgical removal is needed, including hormone replacement therapy. In primary hypogonadism, assisted reproductive technology may be helpful than other treatments. How about yours, Miss Javier?
Okay, now I would like to talk about the treatment which involves in PCOS. So the first treatment includes surgery where removing the cyst from the ovary. Next would be IVF, which is also known as in vitro fertilization, where it is another way to lead into successful pregnancy. Next would be medication to block androgens, where the medication will be used to reduce the level of androgen in the patient's body. Next would be insulin sensitizing medication, and as well as maintain healthy lifestyle where the patient had to reduce body weight and eating healthy.
Thank you for your sharing, Miss Javier. Miss Shahada, if you don't mind, please share yours too. What is the best treatment for your disease?
Treatment for endometriosis aims to alleviate symptoms, reduce pain, and improve fertility, tailored to each individual needs. First-line treatment often include pain management through over-the-counter or prescription medication, such as non-steroidal anti-inflammatory drugs or opioids for severe pains. Hormonal therapies including birth control pills, hormonal patches, or hormonal intrauterine device work by regulating hormonal fluctuations, suppressing ovulation, and reducing the growth of endometrial tissue. By stabilizing hormone levels, this treatment can help alleviate menstrual pain and reduce the progression of endometriosis. For cases resistant to medical management or with severe symptoms, surgical intervention may be necessary. Laparoscopic surgery, also known as minimally invasive surgery, allows for the precise removal of endometrial implants and scar tissue. During surgery, the goal is to excise as much abnormal tissue as possible while preserving reproductive organ to optimize fertility outcomes. Fertility treatments such as in vitro fertilization, which is IVF, may be recommended for women struggling with infertility due to endometriosis. IVF bypass potential barriers posed by endometriosis to achieve pregnancy.
Thank you to all of you for your sharing today. I would like to invite any of you to give the opportunity to end today's discussion by sharing some advice or anything toward the audience that might have infertility problems or maybe wanting to do IVF.
Infertility can cast a shadow over the dreams of many couples, but advancement in reproductive medicine offer rays of hope. When traditional methods fail to achieve pregnancy, IVF provides a personalized approach to overcoming this obstacle. By offering a direct path to pregnancy, IVF serves as a beacon of hope for couples facing the complexities of infertility. While IVF success rate can vary depending, advancement in technology and treatment protocols continually improve outcomes, offering renewed optimism for couples. Nevertheless, IVF represents not just a treatment option, but a lifeline of possibility in their journey to parenthood. To all those facing the challenge of infertility, know that there is a hope. With perseverance, support, and access to advanced reproductive technologies like IVF, the dream of starting a family can become a reality. Together, let's illuminate paths and empower couples on their journey to parenthood. Thank you.
That's all from all of us. Please leave some comments on what topic that our beloved audience want to know next time. We will deliver it to you. See you next time, and thank you for watching.